the intricacies of forensics don't always stop at physical or digital evidence. By studying suspects, we can gain valuable insight into their mental state. And joining us now is Carole Lieberman, forensic psychiatrist. Great to have you on. What is the role of a forensic psychiatrist in an investigation?
Well, a forensic psychiatrist doesn't have bones to look at or computers or, any things. Mostly it's not tangible things. It's looking into the mind of the people involved, the suspect, the defendant, collaterals, in other words, people who have some kind of a relationship to the suspect or defendant or some kind of a relationship to the crime. And you're putting this all together, asking all kinds of questions and putting it all together and trying to form a profile of the criminal, the defendant, and trying to get an understanding of what happened. It's going really a historical kind of understanding. In other words, not just what happened in those moments of the crime, but what happened, what brought these people to this particular moment in time.
Okay, so what types of assessments and evidence can a forensic psychiatrist provide in court?
Well, first of all, there are certain questions that are traditionally asked, starting with, I always go back to childhood. I start with the person's birth. I start with their school experiences, bringing them to the day that we're to the present time. And, but so a lot of times, people, they want to know, well, what does how I did in fifth grade have to do with whether I killed this person? But all of this, you're putting together a portrait. You're painting a portrait of the person and trying to understand motives and so on. Also, there are psychological tests that I administer, personality tests of whether the person is malingering, in other words, lying. So that adds to the picture that you paint. Those are considered objective tests. And sometimes the juries like to have that as backup for the story that you weave in terms of explaining who these people are.
What is unique to the investigation of a forensic psychiatrist that's different from what other investigators are looking at on the same case?
Well, a lot of time. Well, first of all, a psychiatrist is an MD. So in addition to the psychological aspects of a case, there are also oftentimes medical aspects, physical aspects. Did this person have this particular illness, and could they have done this crime? Were they physically capable of doing this crime? Was there certain evidence that one would see with a person with this kind of a medical problem? There are various ways that medicine can come into it as well. And again, you're not looking at something tangible. I mean, actually, there are some times, it's getting actually more often these days, when one of the things you look at, I mean, yes, you don't have bones and you don't have DNA and so on, but videotape is getting to be an increasing part of a case. Analyzing a person and persons through looking at them on videotape.
What are some observable signs that a person can display that you would consider a red flag?
Well, in the examination of the person, if they are trying to lie, if they're trying to cover up their guilt, you see certain behaviors typically like they don't look you straight in the eye. They try to get you to go off on a tangent when you're asking questions. They're getting too close to the truth. They try to be overly charming. They try to get your guard down, especially as a woman. A male suspect or a defendant might try that as a way to sort of get you off the trail.
So fascinating. Thank you so much, Carole Lieberman, forensic psychiatrist. Really appreciate your time today.